Hi, my name is Patricia. I'm a counseling psychologist registered with HCPC here in the UK. And in today's video, I'm going to be talking about certain possible obstacles that you could come across at the point when you're going to start phasing out some of your compulsions in context of OCD. So in a situation when maybe you're starting phasing out some of your compulsions in OCD, your intrusive thoughts, they're going to be really triggered at that point. In order to actually help you with the phasing out behavior, you will perhaps need to try to let go of certain thoughts. So instead of confronting them, instead of neutralizing them, instead of maybe canceling them with certain maybe behaviors, you will have to try to give them less attention, because the more we engage with those thoughts, the more attention we're giving them, the more we argue with them, the more we cancel them, the more we're inviting them. But perhaps by not giving them the usual attention, so by, for example, not canceling them, you might actually start feeling guilty or selfish if maybe your OCD is attached to sense of responsibility over other people. Being able to tolerate sense of being uncertain in a process of recovery from OCD actually plays a really huge part. So when someone, for example, reduces the checking time from maybe 10 times, going back and making sure that the door are closed, and maybe they will reduce that to 3 times, it will be about them tolerating that sense of being uncertain, which people who suffer from OCD, very often they would just describe as a very uncomfortable feeling, as having that sense that something is wrong. And being uncertain is actually a huge part of our life, whether we like it or not, whether we have OCD or not. But actually OCD convinces us that we need to be 100% sure at all times about the specific aspects of life that OCD occupies. It is impossible, because the doubts, they can always creep in and they will dilute that 100% to maybe 99%. When we start challenging OCD behaviors and thought patterns, this definitely will increase the anxiety. But at the same time, you could think that you already live with this anxiety actually every single day. So the anxiety actually behaves in very similar way in OCD, in phobias, in panic. So for example, when you see a snake, your anxiety goes up. Once the snake is gone, your anxiety will go down. But that doesn't change the fact that you still fear the snake. So similarly in OCD, when there's intrusive thought that will spike the anxiety, then maybe you do the compulsion, so maybe you're washing your hands. And when you feel the satisfaction, that's when the anxiety will drop. So with some people, in some cases of OCD, we actually start working with the behavior experiments that they challenge their behaviors. So we also call it exposure and response prevention, ERPs. So people who can actually tolerate the anxiety, they can start with the ERPs. Because what happened is that initially when we started the experiment, the anxiety spikes, so it goes up. And then anxiety in general has this quality that without even us doing anything, the anxiety eventually, when it reaches the peak, it goes down. So in a situation when someone, for instance, normally is washing their hands for half an hour, we would ask you maybe to reduce this time to 10 minutes. And obviously that wouldn't trigger a lot of anxiety in you. But if you can tolerate that anxiety and just sit with it, then you will notice that the anxiety eventually will go down itself. And the more you're gonna practice this experiment, you will also notice that each time the anxiety actually will start taking less and less time to go down. And eventually the anxiety will just diminish. And obviously we need to also consider that those ERPs, they might be a solution for some people, but not for all people with OCD. Additionally, when working with phasing out certain behaviors, when completing the ERPs, that will then trigger a lot of intrusive thoughts. And one way of approaching those intrusive thoughts, it is by maybe ignoring them, by giving them less attention, by not canceling them, or as some authors they say that you can actually disregard your intrusive thoughts. So for instance, if the thought is regarding whether you lock the door or not, you could respond to the thought by saying, maybe I close the door, maybe I haven't, and that will be treating them with disregard. Means not giving this thought much attention, and also by disregarding the thought in this manner, you disengage from that obsessional thought pattern, whether it is engaging with your thoughts without emotions, whether it is treating your thoughts with disregard, or whether it is engaging with the ERPs. All of these interventions, they will require a lot of practice before actually you will start noticing any difference. And you can also do this maybe really simple experiment yourself. You can take a paper and a pen and pick an example and pick a situation that you feel that maybe it's possible for you to tolerate some level of anxiety. So maybe if your compulsion is to wash your hands for 20 minutes, you could agree that I'm gonna wash it only for 2 minutes. And then after washing my hands for 2 minutes, you're gonna have a meal. And then you have to write down what are the predictions. So one of the predictions, it could be that I will get ill, and even the prediction might be that because of that I might die. Another prediction, it might be in relation to anxiety. So very often people, they predict that the anxiety will be so overwhelming that I will just go crazy with it. I will just maybe collapse from the anxiety. So then we're gonna have to write down as well outcomes of this experiment. So one of the outcomes, it will be whether you got ill as a result of you not washing the hands. Was there anything else, any other outcome because of you having washed your hands? And then in context of the anxiety, the outcome, it will be perhaps that yes, the anxiety was very unpleasant, but perhaps you were able to tolerate that, and as well that the outcome will be as well that the anxiety actually went itself down. And then you can, additionally to that, you can write down that, let's say 5 minutes to the experiment, maybe your anxiety was 10 out of 10. Then maybe 20 minutes after you conducted the experiment, the anxiety possibly went maybe to 7 out of 10. And then maybe 1 hour later, maybe the anxiety actually dropped even to 4 out of 10. It is actually quite common that when you come with the intention of working with your OCD in context of the cognitive behavior therapy, the CBT, we do actually expose you to the things that you fear. So yes, if this is the first time you're visiting my channel, then please subscribe and make sure that you hit the notification button. So every time when I upload any video or short, you're gonna get notified so you don't miss out on any of this really interesting content in context of how human mind works. Yeah, I'm gonna see you in the next one then. Thank you. Bye.